Demand for flights is set to soar as Australia prepares to reopen borders after 18 months. Fully vaccinated citizens will be able to travel again as soon as next month. Professor Nigel McMillan from the Menzies Health Institute Queensland explains why Australia is reopening despite record infections in Melbourne.
We've kind of got two situations in Australia. We have two states that are essentially locked down, New South Wales and Victoria, and the rest of the country is free. But we do have about 2,000 cases a day in the last little while. Timing-wise, I think we're going to get to 70% of double vaccinations next week, and we'll reach 80% just at the beginning of November. So I think the timing's pretty much spot on. I think the government are really comfortable with the fact that once we get to 80%, we can start opening things up. We currently seeing quite a lot of stress on the health systems of New South Wales and Victoria, whereas Queensland, Western Australia, South Australia, their systems, of course, aren't under any pressure because they have so few or very little cases. But the health planners are certainly looking at that particular surge and what's going to happen when we open our internal borders, because right now you can't actually come into Queensland or Western Australia from those infected states, is how are we going to handle that surge? The ICU beds are a particular concern because obviously we have not only the COVID patients who want to be in there, but we'll have patients who have strokes and heart attacks who need to be treated that way, and we need to have a surge capacity. So we have a surge capacity of about 8,000 ICU beds in Australia, and there's certainly a lot of planning gone into place. So it's not going to be a surprise, but I think a lot of the controls they're going to have on particularly those states with few cases